So interventional oncology is the nexus of treating patients with life-threatening diseases in a less invasive, more precise manner.
Oh no, this is my third time or fourth time now.
Yes, it is, yeah.
No, this is my third time.
La primera vez que vengo y espero que sea la primera de muchas.
No, from the very beginning.
Well, I've really enjoyed all the sessions because they're so inspiring, and for me as a young researcher, I think it's very interesting to see other perspectives from other countries as well as different institutes.
I like that it's a relatively intimate group of the world's key IOs, doctors. It's one opportunity to see people from Amsterdam, from Miami, from Mayo, and from other parts of the world who come together.
I think the conference is very diverse. The content of the education is the breadth of it. It's just, you can't even define it. It covers all aspects.
Well, I was introduced many years ago in interventional, and I work in a hospital where we do a lot of oncology, especially liver oncology. So that's why I started many years ago treating cancer patients with interventional techniques.
My residency was in a cancer hospital, so since the early days I dedicated my practice to cancer, and after that I did my fellowship in interventional radiology.
We started a lot of years ago. My first ablation was 41 years ago using ethanol, and I was the first person in the world to use radiofrequency with cool tip 11 years later, in 1993.
De ahorita todas.
Well, almost all of them.
Most of them have been excellent, if not all of them. A couple that have stood out the most, there was a presentation on guidelines.
I've attended almost all the presentations so far. I really enjoyed the section on vascular complications and cancer therapies. I've also enjoyed the tumor board discussions about colorectal cancers, neuroendocrine tumor boards. I find that's really helpful and really directly correlates to my daily practice.
For me, I think the smaller sessions with also the edited workshop and hands-on training were most inspiring because you have you first have the presentations and afterwards you can just try for yourself and you have knowledge about the techniques.
Impacto personal, el poder estar en el taller con el Dr. Luigi, por la cercanía y poder platicar con él. Y todo lo que es manejo de guía robótica que no hay en mi país que se está implementando. Entonces ver toda la fusión de tecnología, realidad virtual, etcétera, me gustó mucho.
We know that it works, we know how it works and to whom it works. The problem is that the community, the medical community is not so aware and the patients are not aware. So I think that with better data, with better communication, with more integrated equipments, together with oncologists, clinical practitioners, these techniques will be more and more used because patients with cancer, they are used to go to the hospitals, being operated, heavily treated, so they want many invasive treatments that can give them some free time out of death and even have a cure in many occasions.
I think some of the cutting edge things that we're doing include 190 segment technique, colorectal liver mets. A lot of the non-invasive ablation therapy options are up and coming. New 190 particles. There's too many to count.
So for me, especially, I'm doing research on colorectal liver metastases and the role of thermal ablation. And I think at the moment, thermal ablation is changing guidelines as we speak. We are awaiting the collision results, which are comparing resection to thermal ablation. But eventually, the goal is to get patients the best treatment possible.
For thyroid treatment, for benign nodules of the thyroid gland, I think that surgery will 90% disappear in the next 5 to 10 years.
I think there's a lot of really interesting and cutting edge technologies. There's a lot of precision medicine around digital biomarkers is going to be an increasingly apt area for immuno-oncology. Obviously, we're very excited at AngioDynamics about our products, including NanoKnife.
I think there are lots of innovation, especially the navigation technology, especially robotic and the AI. And I think the next few years, probably the next 5 and 10 years, is going to be really exciting for everyone.
Well, I think that the most important thing is like the multidisciplinary tumor boards. That what I said, the interventional radiology is gaining more and more ground on that field as well. But I think that when you're all together, I think that's the best way to treat the patients. Yeah.
This is the first time in the Interventional Oncology UK that collaborate and meet Spectrum or Spectrum meet IO UK.
I think the softwares for evaluating the liver ablation.
Here I have many things to tell.